All right. So the question is, ACL with meniscus repair at the same time. How does that affect rehab? What do we need to do? What do you look at? What's the experience with that? And I think a couple key things on that is number one, yes, you are going to be limited in your weight bearing. You're also going to be limited in your range of motion typically as
Hmm.
well, depending on where that surgery is. The other thing I want you to think about, though, I think one of the most complicated patients that I ever saw after ACL reconstruction had it was an anterior tibialis graft. I had never even heard of an anterior tibialis graft before.
Okay.
B, he had a calcaneal transposition where they moved the calcaneus over because he had chronic ankle instability. So they moved the insertion of the Achilles so that it would cause him to not sprain as much, plus a lateral ankle reconstruction all at the same time. He was
Mm.
non-weight bearing for 6 weeks in a below knee cast. Okay. And so I'm like, oh my gosh, what am I going to do with this guy? Because, I mean, we're severely limited. And that's actually where he's the one that actually I came up with a discharge checklist concept from, of like giving that at the beginning, because he had an ACL. That was a revision of an ACL reconstruction. I forgot to mention there. But it also really highlighted how important incorporating movement early was, because what happened was I was like, what am I going to do with him besides sit here quad sets and straight leg raises? Like, what are we going to get out of this? And it's very similar to our meniscal meniscal repair. What you need to do, and that's what our ACL rehab guidelines really emphasize, is get all the functional movement, all the movement things corrected while he's in this
Hmm.
period that there's not a lot you can do. So what does that mean? That means correcting cervical patterns, correcting T-spine mobility. Now, are you going to be able to have them do standing rotation? No, but you can check the T-spine even in a lumbar locked seated position. You can get all their hip mobility back and making sure that they have the hip mobility, hip stability, core control. Going to be able to do a lot of rolling patterns and things like that because they're going to be in a brace. You can even just lock out the brace while you're doing that. So what I found, interestingly enough, everybody's talking about ACL visits and limited by insurance. This guy, who is the most complicated ACL reconstruction revision I'd ever had, only had 18 visits over a 14-month period. And the reason is because we cleaned up his movement so well, so early, that as soon as we got to weight bearing stuff, he just went right through. So it kind of forced us to stay low level a lot longer, which actually improved the outcome tremendously. So when you're thinking about, whether, I mean, maybe they have a microfracture procedure, or maybe they actually have some sort of thing that's going to keep them from doing a lot directly with their knee. Yes, you want to get range of motion back. You want to get extension range of motion back, hyperextension range of motion back immediately still. But ultimately, even still working on everything else you can while you do it. And I find it actually doesn't slow down the process. It might speed it up.
Okay. Very cool. I appreciate that answer. And again, I know that following and looking at those guidelines that you recommend as well, it does incorporate a lot of the top tier
Yeah.
and those breakouts and stuff like that. So
Yeah. So in the case of a meniscal repair, you will you'll just not do the weight bearing stuff, as the weight bearing is contraindicated. But the cool thing is you can do all the breakouts in that time, right?
yeah.
Like almost all the breakouts are going to be, now we're probably not doing a lot of tibial rotation and things like that very early on, but we're going to probably get to it pretty quickly, just not in a weight bearing way. So
Yeah, no, I appreciate that. And that's again, I just think that a lot of the early, now there's so much focus on early weight bearing, early weight
mhm.
bearing, and kind of getting that normalized gait and stuff like that. So no, I appreciate that a little depth into what you were talking about there. So
My
uh,
pleasure.
thank you.